So good morning, good afternoon, good evening to everybody watching this from wherever you are. I'm very, very excited for this panel that we have here today. We have some excellent speakers. And the title of this discussion today is Strengthening the TB Response for Post-COVID Through Accountability at the National, Regional, Global Levels. So we all know that we agreed on the UN high-level meeting targets in 2018, and that political declaration really outlined a series of principles and commitments to tackle the disease. These commitments also include ambitious, specific, and time-bound global targets. And since the UN high-level meeting on TB, a lot of countries have started implementing the guidance through institutions and mechanisms that monitor, review, and progress. So in addition, due to the damage caused by COVID, there's also currently an increased need for accountability mechanisms at the regional and national level specifically. So we as the TB community need to remind ourselves that the HLM was hosted to get the world back on track to meeting the NTB goals. And given the impact of COVID, what we really need right now is robust and sustainable mechanisms for accountability at all levels. So without further ado, I'd like to just quickly introduce the panel, the excellent panel that we have. So bringing from the global perspective, we have Diana Weil from the WHO. And Diana is the cross-cutting lead for the NTB strategy and multi-sectoral accountability at the WHO Global TB Program. We have Yulia Kalancha, who is the acting director for the TB Europe Coalition. We have Dr. Imran Pambudi from the National TB Program in Indonesia. We have Rahab Manwiki from the Kenya AIDS NGO Consortium, also called KANCO. And we have Dr. Tiemi Arakawa from the National TB Program in Brazil. So it's absolutely a pleasure to have all of you here. And like I said, without further ado, I'm going to hand over to you, Diana, for your opening remarks.
Thanks so much, Tushar, and it's great to be here with the fellow panelists who I know, and I'm really impressed by the work that everyone's doing. So hopefully, I'd like to just give a little bit of an overview to set the stage, as Tushar has suggested, and then really we want to focus on the actions in the regions and countries that are being presented today. So I'm going to put a couple of slides up that just give some background in line with what Tushar has mentioned about the global environment of what we're addressing right now, and the tools that we have at our disposal. Let me just check if I've got the share screen, and I'm putting mine up. So I want to talk about strengthening accountability and using the WHO multi-sectoral accountability framework in that realm. We have materials on the WHO website, and I'm not going to go into depth about these materials, but they include the framework document that was agreed by member states, as well as a checklist that was developed by many partners and including civil society that can be used at country level for assessing accountability. The rationale for a MAF-TB, for a framework for accountability for TB, came out of the feeling, as Tushar has noted, that we're not making fast enough progress. And one of the empty points was the level of accountability at the highest levels of government, and some of the tools that we know in many contexts really can drive accountability, forcing change, promoting engagement and impact. This framework was requested in the Moscow Declaration coming out of the Global Ministerial Conference that was held in Moscow in 2007 on ending TB. It was reinforced by all member states in the World Health Assembly resolution in 2018. And in that, there was a call for developing a framework that would be acceptable to all countries, adaptable by them, cognizant of their legislative and political frameworks, but providing the broad agenda that all countries should be buying into. And then, of course, there was the political declaration of the UN high-level meeting in 2018. And the important point to recognize from that political declaration was not only broad commitments, but a specific commitment by all member states, all governments, to pursue high-level mechanisms, multi-stakeholder mechanisms involving civil society and involving all parts of government and beyond, to promote accountability. And it's one of the last commitments in that declaration. WHO was also asked to pursue the accountability framework and support its implementation and to help build global collaboration to pursue the accountability framework. In the accountability framework, we cover the following 4 components that are recognized as relevant at the global level, and maybe Aaron will come back at the end to some of these global pressure points and important points we have to take forward across all agencies globally. It also is relevant for regional mechanisms, regional bodies, as well, most importantly at the country level. So what are the 4 components? The first is the commitments. Explicit commitments need to be available, need to be clear to all, and those commitments can be iterated based on the results of actions on accountability, and they should be iterated. But they need to be transformed from words into actions. And we know in many countries, there are national strategic plans, and they've been updated in many countries, given the promotion also by the Global Fund to do so. But we need those actions accompanied by domestic budgets, accompanied by global budgets, accompanied by operational plans, and mechanisms to facilitate coordination. We know we need monitoring and reporting. We've got strengths in monitoring and reporting in TB across the world, but we also have weaknesses, and I'm going to mention one of the weaknesses in a minute. And we also call, as one of the components, key components, review mechanisms. You can have reporting, but if nobody's reviewing that, making judgments on what needs to change, what needs to act, and calling on those accountable, including government, to act, you won't get very far, which is why the political declaration called for high-level review mechanisms. So just to finish, I'd like to talk about 7 key priorities for strengthened accountability that we've highlighted. They're in our global TB report this year in terms of the reporting from countries, as well as in our efforts working with countries, including Indonesia and others, and in Eastern Europe, along with the TB Euro Coalition, looking at ways to get these priorities moving. And one of them is formalized commitments and targets for the national NTB response in the guise of a law and a decree. And I know Dr. Imran will be talking to that. Another is, as we've noted, creation of a high-level review mechanism, or using one that's established but is meaningful review of TB performance. A third is an up-to-date national strategic plan with the budget and the budget allocation, as I mentioned. The fourth is the adoption and rollout of WHO guidelines using the newest technologies and approaches to fight TB, and this was highlighted in the political declaration as well. The fifth is an operational mechanism beyond high-level review to coordinate across sectors, across individuals, across all the key players that can make a difference at different levels of government. We know that different levels of government matter in different countries, and particularly federal systems. We need to get lower levels of government deeply engaged, because that's where the power moves performance. The sixth is civil society and affected communities. Their engagement must be involved in every step of the way in national TB programs and a whole of government response. And those mechanisms for community engagement need to be formalized, and their audits and review of government actions are critical. And lastly, a national TB report on the TB response, particularly a high-level executive summary that can be used for advocacy and reporting and review. Some countries have these reports. Many have lost their reports in recent years and need to return to produce those. So I'd like to conclude by saying that I think this is a time for accountability to accelerate action, and I really look forward to hearing about the country experiences. Thank you.
Thanks so much, Diana. My name is Aaron Oxley. I'm the Executive Director of Results UK, and with Tushar, the two of us sit as co-chairs of the TB Accountability Platform, where we've been taking forward a lot of this work from month to month. It's my pleasure to be also co-chairing this session today. It's also my big pleasure to introduce our next speaker, is Yulia Kalancha. She's a specialist in European law. Since 2011, has been working in public health, involved in processes related to expanding access to treatment at the national, regional, and international level. She's the executive director of the TB Europe Coalition, which for those of you who are not familiar, is a regional advocacy network of civil society organizations and individuals from across the WHO Europe region, comprising Western and Eastern Europe, the Caucasus, and Central Asia. It's really our pleasure, Yulia, to have you with us today, and we look forward to hearing your remarks.
Thank you, Aaron. So I will echo what Diana already said, but just from the regional perspective. So overall, governments have shown positive developments in achieving the agreed commitments and targets, and have taken the necessary measure to ensure timely detection, quality, and effective diagnosis and treatment, and to achieve a sustainable funding to NTB. There is no clear line, of course, for the WHO Europe region between 2018 and the following years to certainly say that our success in TB care were influenced by the UNHLM on TB, but still the signed political declaration has become a powerful tool for civil society organization to influence and leverage the political will at country levels. And the biggest success of the WHO Europe region in MAF-TB implementation, I think, is the synergy and cooperation between WHO Regional Office for Europe and civil society organization. In addition to the WHO implementing activities, all activities related to involvement of civil society and TB community in MAF-TB are supported by TB Europe Coalition. And thus such synergy ensures that civil society and TB affected community are having an important role at all stages of promoting MAF-TB in the region. And I think that this example of effective collaboration can serve as an example for other regions as well. In our region, civil society is a driving force to keep TB high on the political agenda and sustain political will in MAF-TB activities through, for example, conducting national dialogues in partnership with WHO team, which gives decision makers a better understanding of what is expected from them and what MAF-TB is and how it should be implemented. Because very often people, decision makers who in theory should know about such a mechanism, they have no idea about its existence. So online meeting, calls, and presentation can significantly speed up the implementation process. It is also important to use existing platforms such as CCM, national working groups, to present MAF in countries to a wide range of partners and decision makers, not only from the health sector, and this is what we are doing in the region in coordination and partnership with WHO. Also, what I want to mark is engaging with the global TB caucus and MPs, especially with those who are part of health committees, gives a very good results at country levels. For example, in Ukraine, thanks to the fact that the MP sent a letter to the Prime Minister, the Prime Minister gave an order to the Minister of Health that CCM officially should become the platform for MAF-TB implementation. It's important to make presentations for MPs, to produce analytical notes, leaflets, and other documents, because when MP understand the issue, they can become your main companion, I would say, at the country level. So, for example, during one of the meetings organized by TB Caucus, the MP understood that there are certain and very specific targets that a country must achieve, and now MP make other decision makers accountable and make sure that all national strategic documents correspond to the targets and numbers needed to achieve commitments of the political declaration. As a part of Stop TB Partnership project, we are also implementing many activities that will help civil society to better understand the MAF TB principles, as well as how civil society organization could contribute to the national stakeholders' decision as for the defining of the key ministries beyond the Ministry of Health and agencies to be priority targets of the MAF TB processes. So for the meaningful engagement of decision makers for decision processes, civil society and affected community should be well aware of the functions, not only of the Ministry of Health and national TB programs, but also of the function and cross-cutting interest of the ministries, which could contribute and accelerate fight with TB under the broadened framework of health and well-being, such as Ministry of Social Policy, Ministry of Justice, and other ministries. And therefore, it is important to carry out such analysis at the country levels, which we are doing, for example, in Ukraine, and we will share this experience with other countries in the region. And of course, one of the most important elements in the implementation of the political declaration in the region and MAFTB in general is the MAFTB assessments. So such assessments will be done this year as well by WHO ERA, but in a very close cooperation with civil society organization implementing Annex 2. So I think this experience could be also taken by other region and civil society organizations regarding the very close cooperation with WHO. And in the end, I would like to say that especially now we need to join our efforts and resources of all sectors to end TB by 2030. So I'm in.
Thank you so much for that, Yulia. That was really great. Next, we have Dr. Imran Pambudi, the Indonesian National TB Program Manager. Dr. Imran has been forever an ally to civil society and parliamentarians, and he's been doing some fantastic work in Indonesia with the multi-sectoral accountability. So over to you, Dr. Imran.
Yeah, thank you, Tushar. So greetings from Indonesia to all of you attending to talk today. I'm grateful to that despite the COVID-19 pandemics, we can still talk virtually. And it is more important than ever for us to strengthen and learn from one another to accelerate our effort in ending tuberculosis. I will share my reflection on how during this pandemic, Indonesia have unprecedented support in our fight against tuberculosis, a disease that kills around 250 people in our country every day. So allow me to share screen. Okay. Yeah. So one of the principles to improve our health systems for those who need it the most and effective is accountability, like Diane mentioned. However, accountability is not as simple about answerability and sanction for the sake of compliance or transparency. Accountability anchors in a purpose. In Indonesia, our purpose is to improve patient-centered TB service delivery and management through feedback and learning between government and its partners. Our effort to provide the best possible care for people affected by TB requires political commitment, sustainable, adequate domestic financing, and multi-sectoral actions. It is also no small feat to converge public and private interests, but it's possible to leverage existing capacities and linkages among various actors toward achieving our purpose. This was evident when we constructed our National Strategic Plan for TB 2020-2024, involving consultation of more than 200 individuals and feedback from all over 100 people. Tuberculosis is a disease existing from ancient times. The TB epidemic is affected by numerous determinants ranging from urbanization, migration, climate change, and structural factors such as social and economic policies. Various stakeholders have roles to address challenges affecting TB such as poverty and low education, food insecurity, stigma, and discrimination and marginalization, and also unhealthy behaviors which develop environmental conditions favoring transmission and impair one's immunity system. As you can see here, a lot of risk factors drive the TB epidemic. Therefore, a multi-sectoral approach grounded in accountability is a must to end TB. So during this pandemic, the close working relationship of government, civil societies, and communities for TB, which are grounded in accountability, have yielded synergistic outcome in 2020. There are three types of outcomes. First, policies and legislations. Since the beginning of the COVID-19 pandemic in our country, in March 2020, the Ministry of Health launched a TB service protocol during COVID-19 at the World TB Day press conference with the national media. Our partner, Stop TB Partnership Indonesia, also closely advocate to the House of Representatives, and after a hearing between MOH and the Parliament in April, it was noted that TB budget should not be shifted for COVID-19 response, and they asked to close gaps in TB budget. And in August, we also received support from the Ministry of Home Affairs to remind head of district to allocate resources to ensure continuity of TB and HIV services amidst the pandemic. And by the end of this year, we also have a draft on the presidential decree on tuberculosis. The second, the community monitoring and reporting. Outcomes from a rapid survey from the implementation of TB service protocol during pandemic suggested updating the Ministerial of Health law on TB to be more patient-centered and optimize the digital approach in the country's TB response. The survey was done together by NTP with Stop TB Partnership Indonesia, Health Institution of Nahdlatul Ulama, a faith-based organization, and PRTB Asia, and also Indonesia TB Patient Survivors Organization. This experience have elucidated that NTP is best positioned to end TB with feedback from civil societies. This concrete partnership is a great approach to improve performance and promote learning from both NTP and CSO and communities. And the third, we are grateful that we can increase our support to Indonesians in delivering TB care and prevention grounded in equity. Our TB budget increased nearly threefold from 2020 following a presidential high-level meeting with several relevant ministries in July. This advancement does not happen overnight, but advocacy effort built following the UN HLM on TB in 2018 by government, private sector, GSO, and affected communities leading up to the Presidential TB Initiative event in Chimay in January 2020. And following the event, the President continuously spoke about TB in other meetings, such as the opening of the 2020 National Development Agenda. And throughout it all, there were times when our partners held an accountable to deliver our commitment to NTB and to step up during the pandemic. I would like to take this opportunity to thank all of you whenever you are for all of you do to make sure that we are all still on track on TB despite COVID-19, especially civil societies and communities who are directly or indirectly affected by TB. Thank you.
Thank you, Dr. Imran. It's really wonderful to hear from you. And special thanks to you for your commitment to working in partnership to end TB. We've been hearing a lot about great things, scaled up energy and initiative to end TB in Indonesia. And this is a really powerful display of what that looks like in practice. I was particularly struck by the complexity of your multi-sector approach slide that really makes it even clearer that while we should be looking at the global level for the headline figures and the high level accountability and review at that level, so much of the accountability we need actually has to be driven at the local level by people who have that detailed local knowledge of how things work in countries. Your mention of community monitoring and the patient-centered approach is also a really powerful way of helping make that real. Thank you for all of that. And of course, getting more money from the Ministry of Finance and from a presidential decree is very reassuring that this work will be properly funded and expanded. So thank you for everything you do, and congratulations to Indonesia. It's really my pleasure now to move to Rehab Wankini. She is the campaigns manager at Kanko, a good friend of mine and an absolute expert in public health. 15 years of progressive experience of designing, planning, implementation, monitoring, evaluation, and building capacity of programs in child health and development. I could think of fewer better experts to talk to us on this subject. Rehab, over to you.
Thank you so much, Aaron, for such a good introduction. So I'm trying to look for my slide, just a minute. As I try to put up my slides, I just want to say that one of the things as an African country we are trying to solve is the issue of the triple burden of HIV in this country, where as Kenya, we are one of among the top 30 countries in the world, which are still struggling to manage and find the missing cases of TB. So my presentation will try address some of these issues and some of the things we have done collaboratively with the government of Kenya and in the various forums, including the CCM, the WHO multi-sectoral framework. Yeah, thank you. Thank you for your patience. So I'll quickly go to the presentation and just say the presentation about National Strategic Plan for TB in Kenya and the National Strategy on TB and Human Rights. So burden of TB in Kenya. Kenya is listed among the 30 high burden countries for TB. We have TB, we have TB HIV co-infection, and then we have MDR TB. So we also note that in Kenya, TB is the 4th cause of death among infectious diseases. And it's a public health problem in Kenya because of issues of congestion, of even how transport system is in this country, where we have high capacity vehicles that are low cost, and that's what most Kenyans can afford. And when we did the HIV TB prevalence survey, it found out that we have an estimated 86,000 people with TB who are missing from the health system, which represents 40% of patients who have TB, implying that there's still community transmission of TB in our communities. It could be TB, MDR, and just what you're also experiencing even now during COVID. We did, from also the prevalence, we found that we also have financial, social, and nutrition support in Kenya, where food poverty is at 32%, translating to 14.5 million people at risk of malnutrition. That's among the general population. And then we have that 6.1% of people living below the national poverty line. That was a national census by 2016. And the coverage of health insurance is at 19%. And this now has gone down because of COVID. And many of TB patients who need the services are not able to access because now the insurance is not active because they don't have income, or the breadwinner is not able to get a job or any source of income. So when you look at distribution of patients severely malnourished, you can see the red is part of where we have the arid areas, and the green is where we have the highlands and where people can access food. The creamish area is also part of the arid areas where we also have just normal malnutrition in this country for children under 5, for adults, and also especially when there's drought or when there's floods. So when you go to the catastrophic cost, we found that households incur catastrophic costs are between 21% to 53.7%. that are experiencing food insecurity due to TB. We need to understand that because of the metabolism of the food of the human system, when somebody does not have enough food, they don't even have energy to work, to walk, and do the small things that a normal person is able to do. The proportion of TB patients living below poverty line increased from 13.9% to 31.1%. The minute these people were diagnosed with TB, the poverty line increased. And what that means is now, if in their household they were the breadwinner, especially for men, which is the highest category of people with TB in our country, then the food was even food insecure. So we did develop a national strategic plan, and we had to borrow from the impact target by 2030, where we are saying we need to have 0 families facing catastrophic costs due to TB, leprosy, or lung disease. We need to reduce the burden of chronic lung disease by 20% compared to 2015. We need to reduce the proportion of people with leprosy diagnosed with a grade 2 disability to below 5%. And I want to say that we are getting to realize we are getting leprosy cases coming back to the country, yet this was a disease that had been eliminated. Then we need to reduce the TB incidence rate by 80% compared to 2015, and we need to reduce TB deaths by 90% compared to 2015. If we look at the strategic plan for Kenya, which is from 2019 to 2023, it's saying we have 5 strategic focus. One is closing the gap along the care continuum to find and cure all people with TB. The second one is differentiated response by counties to address TB in local context. Why we are saying of counties is because health is now a devolved function. We have 4 devolved functions in the county governments, and health is one of them. And most of the health facilities are at that level of devolution. We need to optimize the implementation of TB, leprosy, and lung health since services within universal health coverage, which Kenya is taking forward as one of the big 4 agenda for economic development in the country. And we need to prevent infection, active disease, morbidity, and mortality due to TB, leprosy, and lung disease. Patient-centered approach that promotes quality of care that my colleague from Indonesia said. And just as I'm here, I need to say that we have launched during COVID-19 the latent TB prevention strategy, where Kenya government has committed enough funding to make sure that the key population, vulnerable population, TB community, including prisoners, are put on TB treatment. The other issue I want to bring out is that we are going specifically to look for children under 5, because this is a category of children that, this is a category of population, most of the time we tend to forget about and just focus on adults, but we also need to acknowledge that diagnosis of TB among children is a bit challenging. And therefore, in order to support this strategy, the government has embraced TB LAM, which is the use of urine to test for TB, and is also now going to embrace the use of TrueNut diagnostic for isoniazid sensitivity, that is from next year. So we did a comparison of DSTB case notification by June 2019 and June this year, and we found that by March, if you look at pediatrics, we had, in 2019, we had 11.1%, yet in May this year, 7.9%, meaning the children who need to have been rightly diagnosed with TB were missing. And it's still the case now, though there's an improvement because we are no longer under lockdown, but there's still fear of contracting TB. We are now seeing from this week more cases of COVID-19 coming up. So thank you so much. I just want to say that one of the things that came about the human rights was the isolation centers. You get a patient who has MDR TB patient, goes to the facility, and is asked to go back home. That provides a very serious situation because most of these people, sorry, most of these people they are like 5 families in a single room of 10 by 10 feet. So when you tell such a parent to go and isolate, where are they going to isolate? And one of the things that came up is when the isolation policy was launched, we are now seeing that some of the county governments are coming up with isolation units for TB patients, especially MDR, or for those who are defaulting treatment. Instead of imprisoning them, like was the case in the previous years, they are now being contained at the health facility. Then DOTS is applied to them, and then they're able to recover very quickly. So thank you so much for the opportunity. Thank you.
Thank you so much, Rahab, and thank you so much for bringing that perspective on really the impact of COVID, as well as taking these global targets and breaking them down to the national level. That's really what we need to be saying about countries taking on that ownership. I just want to introduce Dr. Tiemi Arakawa. She's a registered nurse, and she works as a technical consultant at the Brazilian National TB Program since 2009. She also has a PhD in public health and has experience in monitoring and evaluation with an emphasis on the management of TB programs. So over to you, Dr. Tiemi.
Thank you, everyone. Thank you so much for this opportunity to share the Brazilian experience in establishing a multi-sectoral accountability framework for TB. I'm also going to share my screen, just a second. Okay, so I would like to begin by saying that Brazil has some unique characteristics. We have a universal health system established in the early 90s after a so-called sanitary reform movement, which engaged health professionals, academics, politicians, civil society, and many others towards this idea that health is a right. So what is written in our constitution upon the state's obligation to ensure the right to health and the history of this sanitary reform movement brings me the idea that accountability in health is something that Brazil has dealing for a long time. The constitutional definition of health that states that health is not only the access to healthcare, but also the access to food, to water, housing, employment, and income, also reminds me that we also have been considering this multi-sectoral perspective in our national context. Even with these unique characteristics, with all the strengths and progress how they mean to us, we are dealing with real life. We still face poverty, health inequalities, lack of healthcare access, and many challenges when it comes to TB control. A national TB program has an important role in promoting accountability mechanisms, especially in Brazil, where the state and municipal level have a degree of autonomy in the management of their local health system. But the federal level, and in this case, the National TB Program, has the responsibility to define the guidelines and the principles for TB control policy. What we do is an example for the local level to follow. Regarding the multi-sectoral engagement, we've been developing collaboration with other ministries, especially the Ministry of Justice, when we think about TB control among prison population, and also the Ministry of Social Development to promote social protection for TB affected people. We also have worked closely with other intra-sectoral partners like the HIV National Program, the Primary Healthcare Coordination, and so on. And we have other partners as the Parliament, our Brazilian TB Caucus, academics, and civil society. We have a strategic national plan based on the 3 pillars of the NTB strategy as a way to document, explicitly document, as Diana said, our goals, commitments, and strategies. TB control activities are performed under the structure of this universal health system. We have a national recording and reporting system and established monitoring indicators. But when we look when the elements of the MAF TB, the MAF framework, what do we miss? We missed a high-level review mechanism, a structure, a formal structure where we could put all of this together. We tried to establish a high-level review mechanism during the past year, but we kind of failed. And I would like to go through that and explain what happened and what lessons have we learned. Just after the Moscow ministerial meeting, we asked for a legal consultation in the Brazilian Ministry of Health to create an interministerial committee on TB response. But we faced some legal restrictions to establish such a committee. We needed a presidential decision, a presidential decree to do that. But 2018 was election year. 2019 was the first year of mandate. And 2020, the pandemic came. It was not the best political timing to create such an structure. But that impossibility did not put us down. We learned and we tried to create alternatives. We identified that the formal engagement of other ministries in the TB response could be sought through terms of reference. It was the legal tool that we have in this moment. And to truly establish the multi-sectoral accountability framework, we know how important it is to identify and especially to document the steps that were taken in the past. We presented and we are promoting the discussion about MAF with our partners, letting them know that this is a global initiative, this is a broader discussion, but also highlighting the existing bodies and tools for social control and for review mechanisms of public health policies here in Brazil. We have participatory councils in the municipal, state, and federal levels that are a very good progress for us trying to establish MAF. And finally, this year, we are updating our national strategic plan. This is a core document, a core tool, our main line to involve our partners and enable the establishment of joint work plans and an organized review process. This was a little bit of the experience here in Brazil. And with that, I think we are going to have a very, very good discussion. Thank you so much.
Thank you so much, Dr. Thieme, and thank you to all of our speakers. Unfortunately, I've been flagged by the moderator that we have very little time left. So what I'd like to do is, by way of summing up, is actually as you've been speaking, we've created some questions for each of you. And what I'd like to do is, as sort of by way of summing up, is to effectively ask those questions and sort of, we won't have time to answer them. So if you can think of a one-sentence reply to the question as I read them out, then we'll come back to you. But otherwise, we will unfortunately be out of time. I think what this does uncover, though, is that we have a real richness and accountability to explore. And we're seeing a real wealth of work happening on this at every possible level. So let me go through all these questions. So, I'll do them in speaker order. Diana, first one that I was hoping to have a chance to unpack with you a bit. And you mentioned high-level review quite a lot, where heads of state and government are able to look in depth at their results, how they can compare to their country's own past performance, and also in relation to their peers. And ultimately, because of course it's review, they can be challenged to do better. I'd be really interested, and I think it'd be really good for us to unpack a bit about the recent United Nations Secretary General's report and how that was a moment for high-level review, how we can better leverage that. And also, what do we see as some of the biggest opportunities to do global high-level review activity in between now and the next UN HLM? Julia, really great to hear from you about your regional work and the country, the work that the TBEC is able and TBEC's partners are able to do in country. Very impressive work there in terms of accountability and bringing in and using the very helpful WHO multi-sector accountability framework. And I guess my question that I'd love to unpack more with you, again, if we had time, was how can we scale the national and regional work to global, and at what level are certain activities most effective and most impactful? Your experience in those things would be really great to be able to talk more about. For Dr. Imran, really an impressive list of policy and financing and programmatic successes for Indonesia in 2020. It seems very clear that your head of state is engaged, as are many of the other pieces of government. And I mean, I think, well done, but progress like that doesn't happen overnight. That's usually the result of much hard work by many people. So I would love with you to unpack and find out how you would explain how this has happened. What's the cause of this? How did we manage to get TB to rise up the political agenda in Indonesia? Because I think the results there are very impressive. Going to Rahab, you spoke a lot about bringing the experiences of people on the ground into the Ministry of Health. And I think here, kind of your experiences and understanding how important the voice of people that are directly affected by TB and the voice of the people that who work in TB care and that are caring for them, how are those voices best used and how important are they in driving the policy and accountability agenda? I think there's some interesting examples to learn from Kenya there. And lastly, for Dr. Chemi, it was really encouraging to hear everything that you've done, but of course, disappointing to hear how difficult it has been at the national level to be driving high-level engagement in Brazil. I think your experience is not unique in that regard. And I think, as quite often what is the missing piece of the puzzle, I'd love to hear more about if we could have had more external push on some of those things or external support or coordination. How could the rest of the world have helped Brazil to get more engaged at that very highest level? Because I think it's very clear that you're doing great work at the national level there. But I am afraid that with those questions hanging over us, we are completely out of time. If we were in the room, we would be begging the organizers to let us stay in the hall. Unfortunately, we can't. So Tushar, it sort of falls to the both of us to say a massive thank you to all of our panelists. I really wish we had longer to talk. We do have TB accountability calls very regularly where some of these things are unpacked. So would welcome anybody in the TB community to join those. You can reach out to Tushar or myself to get connected into them. But again, big thank you to all 5 of our panelists. Thank you very much to Tushar, who's done all of the heavy lifting on the organization and deserves all of the credit. Well done, Tushar. Thank you so much. But I'm very sorry I have to call this panel to a close.